Emergency management for a first aider. Introduction to the module. In this module, the management sector during an incident is described. Before providing first aid treatment, it is necessary to know how to assess the situation. Topics to be covered. The topics that will be covered are: emergency first aid, roles of first aider during an incident, tasks during emergency, tasks to do, tasks to avoid, steps to analyze, dangers of the situation, understanding the casualty, cause of the accident, main injuries, safety measures, assessing the casualty. Emergency first aid. In any emergency, recognition of the problem and providing help is the first step. When in doubt or when someone is seriously injured or ill, you should always activate the emergency response system. Management of emergencies is an integral part of primary care. Being first contact care providers, general practitioners may encounter any type of emergency. Acute attacks of asthma, head injuries and trauma are some of the common emergencies encountered by first aiders. Updated knowledge, communication and procedural skills, trained paramedical staff, and medications are vital to providing optimum care, which may even save the lives of patients. This broadly can be summarized as contacting emergency services and preventing cross-infections, applying first aid to someone who may be choking, bleeding, or suffering from shock, adult casualty who is unconscious, including seizure, applying resuscitation to an injured who may be unconscious, giving appropriate first aid treatment for minor injuries such as cuts, bruises, burns, and scalds, acting appropriately during an emergency, and providing as much medical assistance as deemed possible. Roles of first aider during an incident. During an emergency or accident, a trained deaf or emergency first aid worker will be expected to play a significant role in the proceedings and manage the incident itself. The main responsibilities will be to ensure the safety of those injured, any bystanders, and themselves, ensure or arrange the arrival of emergency services, assess the situation and severity of the injuries or illness, provide medical assistance according to their training and knowledge, and according to priorities. To make a full record of all details regarding the incident and actions taken, which should be handed over to emergency services when they arrive. Mandatory paperwork should also be completed. Tasks during emergency. The best practice during an emergency will depend upon the casualties, injuries and type of incident. We will examine some types of specific emergencies and their treatments in the upcoming discussion. But there are some common sense do's and don'ts that all first aiders should be aware of. Tasks to do. Tell the casualty, and those in the vicinity, that you are a trained first aider. Remain confident and calm and explain any activities or tasks that you are performing. Gain the patient's trust and try to alleviate their pain as much as possible. The symptoms of seizures vary. The person may fall down or make abnormal movements, their head might jerk, and eyes flutter. Assess the severity of a patient's condition and prioritize accordingly. Maintain a good level of personal hygiene and keep yourself and those around you safe from infection. Check for broken bones and other injuries. Check breathing. Listen for breathing through the nose, watch the chest for rise and fall. Take a pulse, either at the wrist or neck. If they are breathing and have a pulse, you should stay with them to offer support. Tasks to avoid. Don't delay in calling 999 or emergency services unless you are positive that they are not required. Don't move the injured party unless it is absolutely essential to do so. Don't forget to clear the area at the incident and ensure there is no risk to any personnel. Steps to analyze. Few steps should be analyzed before providing first aid treatment. Dangers of the situation. A first aider has a moral obligation to protect himself from harm. Any first aid personnel should immediately assess the situation in an emergency. Look for any serious risk to personal safety, such as falling debris, hazardous materials, or violent or unstable people. If there is a genuine risk to your well-being, then you are well within your rights to remove yourself from the area and call for appropriate assistance. Only stay on the scene if you are satisfied that there is no personal risk involved. After all, no one will wish for any further casualties if they are preventable. Understanding the casualty. After the initial risk assessment at an emergency scene and the confirmation that there are no immediate dangers, a first aider should check whether they are able to fully approach the casualty or not. This will depend on the status of the environment, accessibility, people in the vicinity, etc., and the condition of the patient, distressed, in extreme pain, etc. If the casualty is fully conscious, try to obtain consent before you touch or approach them. Also, be fully aware of your surroundings, but only move the patient if it is absolutely vital to their well-being. Cause of the accident. If the cause of an accident is not immediately obvious, a first aider must determine if there is any risk of a reoccurrence, falling debris, etc., and react accordingly. If the danger has passed or been fully mitigated, then treatment can proceed as applicable. Even if the cause of an accident or illness cannot be categorically identified at the time, every detail and event should be recorded to aid future investigations and treatments. Main injuries. In some cases, such as burns and cuts, the severity and placement of an injury can be quickly identified. But a first aider should never take things purely at first sight. Always communicate directly with the patient if possible, and get as much information as possible. Also, take into consideration observations such as visually obvious clues such as bleeding, scratches, swellings, deformities of the body, etc. Loss of sense or feeling in any part of the body. Audible problems with their breathing. Ongoing pain or discomfort in a particular part of the body. Safety measures. Although the initial assessment from a first aider should determine any risks or danger at the scene, they should also ensure that the area remains safe to themselves, the casualty, and everybody else. Therefore, they should ensure that the area is as clear as possible and not susceptible to any interruptions or further incidents. To that end, the first aider should check on the normal use of the area, and whether it would be appropriate to apply warning signs or borders, particularly from when vehicles or bystanders may be involved. If the area is believed to be unsafe, then, and only then, should the casualty be moved somewhere else. Assessing the casualty. If the patient is conscious, it is extremely important that you communicate with them as much as possible and get feedback on their well-being. An existing health condition, diabetes, asthma, etc., have an impact on their status and your assessment. If there are multiple casualties, those with life-threatening injuries or conditions must be helped first. Also, check on the following aspects of the casualty. Attention span, do they become dizzy or periodically lose alertness? Skin color, is it becoming pale or inflamed? Response to stimulus, are they responding to touch or treatment negatively? Taking all those questions into consideration should allow any first aider to provide an accurate assessment of an emergency situation. Assess the situation quickly and calmly to understand what happened. This involves determining whether anyone is in danger, the cause of the situation, and how many people are affected. Summary. This module can be summarized as: the best practice during an emergency will depend upon the casualties, injuries and type of incident. An existing health condition, diabetes, asthma, etc., have an impact on their status and your assessment. Always communicate directly with the patient if possible, and get as much information as possible. A first aider has a moral obligation to protect himself from harm. Any first aid personnel should immediately assess the situation in an emergency. If the area is believed to be unsafe, then, and only then, should the casualty be moved somewhere else. Thank you. This is the end of this module. Thanks for watching. Happy learning.